Hi, everyone, and welcome to my conference on conflict resolution. We have all had to deal with conflicts in our lives. Conflicts in the workplace, when left unresolved, can fester into an uncomfortable and dysfunctional work environment. Conflict resolution is an essential tool in a leader's toolbox. Addressing and resolving the conflict quickly is vital to maintaining a productive work environment. In the medical field, staff must work together in commonality to ensure safe patient care. Knowing how to handle conflicts at work and reaching a peaceful solution promotes a healthy working environment, healthy working relationships, and positive patient outcomes. There are different types of strategies for conflict resolution, such as sympathetic listening, mediation, or group sourcing the problem. As a leader, identifying the conflict is necessary. Then understanding who it involves and how it disrupts staff and or patient interactions. There could be right and wrong ways to handle conflicts in the workplace. A good leader may use several different techniques to resolving an issue. For example, sympathetic listening is when you put yourself in someone else's shoes. People do not have to have the same working ethics and values. Leaders have to find common ground, discuss areas of disagreements, and find a suitable resolution, all while respecting the differences in personalities, cultures, educational levels, and life experiences of everyone involved. The healthcare industry is a profession where we have chosen to care for people. It is also essential that we not only care about our patients, but also our team too. In caring for others, we are responsible for our behaviors, actions, and reactions and attitudes. Leaders must recognize how to manage the conflict and resolve the situation effectively and strategically. According to the article, through the resolution of conflict, it is human to disagree. Since the beginning of history, people have challenged new ideas. Those disagreements encourage debates and discoveries, which is a positive part of conflict. Constructively approaching conflict can create an atmosphere of unity. According to Herzog, the nursing profession is an occupation that is already stressed, which we all can agree. Learning how to deal with conflicts effectively improves the workplace and promotes unity. To resolve a dispute, consider the problem or disagreement, then assess the issue, your involvement in the conflict, and decide if it's a benefit worth the cost. Dealing with conflict in a constructive manner is imperative to maintaining a positive atmosphere while working towards a common goal of delivering safe patient care, which we all want. I have always believed in saying, "I understand." It is something that a leader should be able to do easily. When conflicts occur, sometimes just taking a step back, regardless of a right or wrong, can de-escalate the tense situation. Afterwards, when all parties involved have calmed down, communication and respect can create an avenue to resolve the disagreement. When a conflict is not resolved or not resolved quickly, patient care is adversely affected, which is something that we don't want. Distractions, resentment, poor attitudes, and a decrease in productivity will follow. As leaders, we should learn to resolve conflicts without escalation, respect each other. Conflict resolution in the workplace is vital for harmonious teamwork. I personally have had to handle more conflicts in this past year due to COVID-19 than I would like to admit. As an infection control nurse, I experienced disputes with management and staff due to daily changes in the mandates from the Centers for Disease Control, the Health Department, and the Centers for Medicare and Medicaid Services. All of these things were set in place to protect the patients, but with the changing in daily mandates, it created a environment of more stress. The requirements for mandatory testing, removing staff from work due to exposure, staffing shortages, increased anxiety and uncertainty, and limited supplies were also causes for disagreements. I had to learn to be patient, to listen to others, and find common ground, while following the required guidelines to maintaining safe patient care. It is essential to know when to engage and when to walk away. I am learning to understand the importance of approach and the use of effective communication to resolve conflicts. I had to learn to not be a part of the problem, but part of the solution. And that conflict is healthy when you respect each other, listen to each other, and understand that we're all working together to deliver the best patient care that we can, and leaving filled with a harmonious work environment makes you feel satisfied when you're working. Thank you so much.